has a high burden of malaria. In fact, Africa has a high burden of malaria. Nigeria has one of the highest burdens. In the last year, we've lost thousands, up to about 600,000 people or thereabouts to malaria alone. So malaria is actually a very deadly disease. You know, sometimes in Nigeria, because we all grew up with malaria, quote and unquote, so we don't take malaria so seriously. Oh, I know I have malaria, I'm not feeling so good, but most times within 2, 3 days, max 1 week of treatment, most people will bounce back from malaria. It's not usually the case for those that have not been exposed to malaria, the malaria parasite from birth. In fact, that's why you see that a lot of the people from the Western world or Nigerians that were born abroad and they come back to Nigeria, they often have to take like what we call prophylaxis medications to protect them from malaria if they're coming here to visit. Because for people that have not grown up with, let's say, malaria, they've not gained some kind of immunity that comes with repeated infections, quote and unquote. So when they come here and if they come down with malaria, it can be quite serious. So I'm just trying to paint how serious malaria can be. And in Nigeria, some of the most common victims of malaria, people that can even die from malaria, usually children under the age of 5. And also we have pregnant women. So they're the most vulnerable to malaria. And that's because at that age, they haven't really built a lot of immunity. That's for the children, and they're still vulnerable. And for pregnant women, pregnancy is a state that can sometimes reduce the effectiveness of your immune system rather, and may make it such that diseases that the pregnant woman would normally overcome, she may not easily overcome them at that moment. So those are the two scenarios. I just try to paint a picture for malaria because it's a very serious infection and it's one of the most common reasons why you go to the hospital. It's the top diagnosis made in most Nigerian hospitals at primary care level. Now let's go on to typhoid. Okay, let's go on to typhoid. But before we go on to it, I already mentioned that there's a parasite that causes malaria. There are 5 species. Just think of the species as different children in the family, so to speak. But the most common are Plasmodium falciparum and Plasmodium vivax. But the Plasmodium falciparum is the most deadly and is also the most common one in our environment again. So let's move on to typhoid. Typhoid fever, when you're feeling ill and they tell you have 2 pluses of typhoid in quotes when you've gone to some interesting lab in your area. So typhoid fever is caused by Salmonella typhi, a bacteria, and it's not so common in developed countries, but in countries like ours that are still developing, it's more common and it's a serious health threat. The issue here is that typhoid fever is actually way more serious than what most of us think it is. To put it in a light way, if you had typhoid fever, you probably not be able to walk to the hospital and say, doctor, I think I have typhoid, and then have enough energy to argue with the doctor that you have typhoid, like some people tend to do. I know those people are not on this call today. So typhoid fever is caused by Salmonella typhi. So you can see that it's different from what causes malaria. And the mode of transmission is different, which shows you why doesn't make any logical sense for you to think you have typhoid and malaria. Malaria is transmitted when you are bitten by a mosquito that's infected with the virus or that is carrying the virus rather. While typhoid is transmitted when you come in contact with contaminated water, food that is containing the virus. And what's the most common way? In the medical language, we call it fecal-oral. Basically, what we are saying is that it's transmitted from human waste, feces, into your food. Like basically, someone that has typhoid has gone to the toilet, maybe the person did not wash their hand properly or something, and has used that same hand to prepare food for you. And that way can be if, let's say, the sockaway system, because especially let's use Lagos for instance, people dig their own sockaway or their septic tanks in their houses, what we call sockaway, and then people also have to sink their own borehole. If by any chance your source of water supply and where you try to dispose your waste, your septic tank, there's some interaction and somebody that has typhoid has been stooling in your toilet and all of that, You can also have the bacteria contaminate your water that you're drinking water, and that can also cause you to have or to come down with typhoid fever. Another way is eating raw vegetables that have been fertilized with human waste, for someone that already has typhoid, contaminated milk products, and also having oral or anal sex with someone that is a carrier. And now this carrier is interesting. For malaria, we don't have carriers per se, the way we have it in typhoid fever. A carrier is someone that has had typhoid fever, has been treated for it, but still has the, let's say, remnants or reservoir of typhoid in the person, meaning that they are still shedding actively bacteria in their stool and maybe in their urine as well. So what can happen is if someone is a carrier of typhoid, the person can actually be transmitting it to everyone without actually coming down with a serious case of typhoid. So that's one of the other tricks or one of the other unique features of typhoid fever as well. Now, when we compare the symptoms of malaria and typhoid, to some extent, there are some similarities. I mean, you can have headache in both of them. You can have muscle aches in both of them. Even stomach pain is not really one of the most common symptoms of malaria, again, depending on the age anyway, but you can also have it in both of them. But in malaria, you have chills, you have fever, you have body pain, they have that bitter taste in your mouth as well. For typhoid fever, the fever is going to be quite high grade as well. You can have headaches, you can have weakness. So when you look at this list of symptoms, you see that there's some similarity, but there's still differences because the typhoid fever, the bacteria will often travel to the digestive tract and multiply there, and you can begin to have stomach pain, have diarrhea, constipation. Some people can begin to have distended abdomen, meaning that their tummy begins to swell and get bigger and bigger. So if you look at this, you would see that while the symptoms are similar, they are also not so similar. So the symptoms of typhoid and malaria are similar. It is true that at the early stage, it's easy to confuse typhoid fever for something else, for any other illness, and you begin to think that maybe any small illness you have, you think it's typhoid. Maybe when you're having fever, you're having headaches, you're having weakness, maybe you're having a dry cough, you're having tummy pain, you think, okay, this tummy pain is typhoid, and that's not necessarily true. So when you go online, which brings you to the use of the internet. When you go online and you read up some symptoms, if you Google stomach pain now, you can see anything from stomach cancer to gastroenteritis. So a list of symptoms alone is not enough to diagnose typhoid fever, neither is it enough to diagnose malaria. You need more testing. You need to see a professional before you actually can be sure that you have malaria, you have typhoid, and then you can get the proper treatment. So let's see who you can see in both of these cases, or how these illnesses are diagnosed rather, sorry. So for malaria, we do what we call a thick and thin film. For malaria, we look at the person's blood under a microscope to see if we can see the parasites. And usually, because the malaria parasites have a distinct way of looking under the microscope, we can pick that up. You can also do an RDT. That's like a rapid diagnostic test. You buy the test kits, you can prick yourself with it. Some of them are do it yourself at home, or some they may do it for you in the lab. So this is like the standard way of diagnosing malaria for us, according to WHO standard. Now for typhoid, what we often have in Nigeria, and which is something to note, is people go to the hospital, they tell them they are going to run malaria and typhoid tests. Really what they do for the typhoid test is that they just do what we call White House. And then based on White House, they say you have typhoid, which is actually bad practice, and it is wrong because you can't actually make a diagnosis of typhoid fever based on just White House alone. According to WHO, the gold standard for typhoid diagnosis is actually taking the blood or stool, taking blood, bone marrow, and then culturing it in a culture. What I mean is, we take samples from the person, either your bone marrow, your blood and stool, and then we culture it to see if we can grow the bacteria, the Salmonella typhi, that actually causes typhoid fever. So diagnosis of typhoid, this is the gold standard, right? Now, we can also use RDT in some cases. because the truth is blood culture can be pretty pricey, can be a bit expensive. And in healthcare facilities, especially in countries like Nigeria, where we are looking at cost. So people may also turn to doing a typhoid RDT, or using a rapid diagnostic kit that can actually detect the antigen. But more often than not, what we have in most labs in Nigeria, the way they diagnose typhoid is actually most times through what we call the White House test. Now, this White House test was developed in the 1800s. It's simple, it's cheap, but the problem with it is that it can mean so many things. If you have another illness, it can actually present as if you have what I'll call, like, you may have typhoid, but really it's not it, because there are so many other illnesses that can interfere with the result of the White House test. So if you're feeling unwell and you go to the hospital and they tell you that you have malaria 2 pluses, and then you have typhoid 1 plus or something, or they say they want to run White House for you, just know that whatever treatment you're getting is probably not the best, because White House on its own is not something you can use to diagnose typhoid fever, which is one of the most important things you should take away from this conversation. Okay, so when you look at it in this manner, you begin to wonder what's going on. I think in Nigeria, it's basically a mix of many things. There's misinformation. There's also the economic factor. There's so many things at play here. But in terms of misinformation, some people have been told repeatedly that White House is what they use. So you can have a patient come to you and tell you, doctor, I believe I have typhoid. I want you to do a White House for me. And it can be quite difficult to convince that person that White House will not tell you that you have typhoid fever, and it happens a lot. So if you are one of those people, it's just take this as an opportunity to understand that White House on its own cannot be used to diagnose typhoid fever. I've shown you what the standard is, and then we can still use RDT. So in the ranking, I'd rather do a culture and then maybe use an RDT before we do White House. White House is at the bottom of the list, and really it should not even come into this conversation, based on the fact that there are so many things that can interfere with the results. You may be having another illness. In fact, the fact that you're having malaria alone can actually also interfere with your White House results. So it's really not the best way to go when it comes to typhoid diagnosis. And the truth is, we've looked at the way these illnesses are transmitted. Malaria, on one hand, for you to have malaria, you have to be bitten by a mosquito that is carrying the parasite. For you to have typhoid fever, you have to come in contact with food, water. You have to come in contact with the bacteria one way or the other, right? So you can see already that one relies on transmission through poor, will I say, sewage disposal or poor water supply systems like we have in Nigeria. The other comes because you have mosquitoes maybe in your area. You've not used insecticide recently, and you also have a lot of mosquitoes, or you have stagnant water somewhere or something where the mosquitoes are breeding. So the truth is that when you look at these two infections, their mode of transmission is different. Their symptoms may be slightly similar, but they are still very different. The typhoid will focus mostly on your digestive tract a lot, most of the time. And in terms of severity, they can be very severe illnesses. But for us here in Nigeria, because of the quote and unquote, I won't call it immunity, but because of the level of, let's say, familiarity our bodies tend to have with malaria, we're able to actually manage malaria well, better than would manage typhoid fever. So treating yourself indiscriminately for typhoid fever can be dangerous, or for malaria, typhoid can be dangerous. Why? Now, there are some other more serious medical conditions, something like systemic lupus erythematosus. Is an autoimmune disease. Well, it's commonly called lupus. Let's call it lupus. Even cancers, tumors, they can be masked. You know, you may, someone that may have a cancer may have some symptoms and be seen like malaria. Why? So a person that has cancer may be feeling tired often, may be having headaches. Maybe you may even have just have some non-specific symptoms. And you know, the common thing in Nigeria, and I've heard it a lot, is, doctor, I know my body. I know when I have malaria. You understand? And that's a very common sentence that a lot of people in the medical practice hear a lot. Doctor, I know my body. I know when I have malaria. And that insistence without even doing a test to check, okay, do you really have malaria? Is there something else going on? Some people have treated, in fact, once you're treating malaria 3, 4, 5 times in 2, 3 months, you should begin to suspect there's something going on. There may be something more at play here. Is it really malaria or is there something else at play? So that's why we always advise when you're feeling ill, always good to speak to a doctor, always good to ensure that tests are done. In fact, because of the poor practice in our environment, you may find that some people may actually be treating you for malaria or typhoid without running tests. I think that as the patient, if you actually come in contact with such a person, a doctor or any health professional that wants to treat you for malaria without running tests, ask them to do a test for you. It doesn't cost anything to do a test. Okay, it costs money, but malaria test isn't that expensive, really. So ask them to run a test for you. For typhoid as well, the same thing. You're feeling ill, you think you have typhoid, let them do a proper test for you. And that test is not White House. Why? Because in the process of being treated for malaria and typhoid repeatedly, or going to a pharmacy and asking the pharmacist to just give you malaria medicine and to give you antibiotics to treat typhoid, you may be hurting yourself. There have been cases of patients that have had cancers. Like there was a case of a patient that was shared that they said the patient had cancer, but nobody knew because the patient kept treating malaria, and the thing kept advancing until it got really bad. They landed in the hospital and they found out that it was malaria. And these cases are more widespread than you think. Or treating malaria, typhoid, and you keep treating it, going to the chemist, buying different medications, trying it, or using agbo as well. And then at the end of the day, you find out that, oh, it was actually malaria. It was actually something more serious like cancer or some other systemic illness. So it's always important to be actually very careful about self-medication, about giving yourself a diagnosis too. So if you're feeling ill, if you're feeling unwell, if you're having symptoms that you're pretty sure that this is malaria, just go to the hospital and do a test. It doesn't cost you much to actually run a malaria test. In most places, the average cost of a malaria test will be between 1,000 to 2,000 naira. So that's small money for certainty. Instead of because there may be something more going on. And if it's a cancer, for instance, you always want to catch a cancer early. If it's a systemic disease like lupus, or maybe tuberculosis or some tumor somewhere, you always want to catch these things early, because when you catch a disease early, you are able to actually get the best results. So that's a summary of, let's say, my take-home message. Typhoid and malaria are not twins. Treating yourself indiscriminately for these illnesses, they can cause you more harm. It can cause you more harm than good. You may think, okay, I'm having malaria symptoms. Let me just go to the chemist and buy malaria medicine. You take it for 3 days, you feel better, but then within another 2 weeks, you're feeling sick again. If you're having such things, you want to go to the hospital and check. You don't want to keep treating yourself, because there will be something more going on. Or it may just be that you have poorly treated malaria. For instance, maybe you're not, whatever you're doing isn't working, so you need to actually go to the hospital and see the doctor. Another danger that comes with taking these drugs indiscriminately is this. And who remembers when quinine, chloroquine were commonly used to treat malaria in Nigeria and all of that, and the rest of the world? But over time, what happened? The malaria gained resistance to these drugs. At the moment, the current malaria drugs are our best bet in treating malaria. And if for some reason these drugs stop working or stop doing the job, in all honesty, we would have more people dying from malaria, and that would be very terrible. So it's simple. Taking malaria medicine indiscriminately now can be harming the future, in the sense that you may cause the parasite to begin to build resistance to the current medications. And the truth is, even in some parts of Asia already, they've noticed that the malaria parasite has resistance to the medications we currently use. And I think they've changed to some other set of drugs. So you want to be careful to ensure that you're not harming the future. If you have some symptoms, see a doctor. On the part of typhoid fever as well, if you are using medications indiscriminately, what may be happening is that you're building resistance, antibiotic resistance. And by the time you really need that medication, it may not work for you because you've taken the antibiotic so many times, probably not taking it at the right dosage. You know, most of us are guilty. By the second day of the malaria medicine, when you're feeling a bit better, you start forgetting your medications, or sometimes some people abandon it there. So you have to be careful to avoid these things. So it's a collective effort. What you do actually plays a role in determining the future, even my future when it comes to my health as well. And what I do also determines your future when it comes to your health as well. So we need to work together to ensure that we don't keep forcing these twins to be together, and that we do our best to ensure that we safeguard ourselves and our health. So when you're ill, see a doctor. Thank you. That's where I'll stop for now, and then I'll take questions if we have any.
Thank you so much, Dr. Okonkwo Oyo. Thank you very much. I believe maybe there are some questions, but before then, I'd just also like to chip in something about the diagnosis of typhoid fever with the Vidal test. You know, just like Dr. Oyo has said, there are other health conditions that can interfere with the Vidal results. Another thing that many may not be aware of is that you may not be able to diagnose typhoid fever on one Vidal test result. There's a phenomenon called a rising titer. And it's when the Vidal test is a certain value today, and in a few days, it's 4 times that value, that you can categorically say that based on the Vidal test results, you know, this person is having, most likely is having typhoid fever, apart from the cultures, the blood and the stool cultures. So do we have any questions